Welcome back to the Thanksgiving edition of Cancer Buzz. I'm your host, Summer Johnson. In this mini episode, ACCC President Krista Nelson gives us her take on practicing intentional gratitude. Krista Nelson is an oncology social worker and the program manager of quality and research at the Providence Cancer Institute in Portland, Oregon. Krista, cancer professionals have had many challenges over the past 2 years, and here we are closing out 2021. We're entering a season of gratitude. What does gratitude look like now? What does gratitude feel like now in 2021?
I think it's really important that during times when things are hard and when things are good, that we really affirm the goodness in the world and that we receive internally what we're seeing. I have two favorite websites on gratitude. One is called gratefulness.org, and the other is The Greater Good out of Berkeley. And I think as you become aware of gratitude, it's so important to recognize the sources of the goodness and that they're outside of ourselves. You know, they're often from other people. We become aware of others, or maybe even a higher power, or even nature and what that gives to us. I think when we share our gratitude, it strengthens our connections and relationships. And in fact, I feel like it can be contagious. I'm reminded of Brother David Steindl-Rast, who's a Benedictine monk, and he has this great teaching that's called Stop, Look, and Go. It's very simple. And I think it talks about a way to just slow down, take stock of your surroundings, and then investigate what's present around you in any moment. Even if something is hard, we can often find something that brings us some joy in that moment. We need to allow ourselves to fully notice and experience everything that's present around us, and then allow it to fill you with a sense of awe and wonder. But it really does take that slowing down, so stopping and then looking, just being aware. And then the go, I think, is really essential. When he speaks his teachings on that, it's more about paying it forward. Sharing your gratitude, allowing the experience to prompt generosity and kindness towards others.
You talked about his teachings. There is a bit of research about gratitude helping us. Where are you looking for inspiration?
I think when I look for inspiration personally, when I think about gratitude, I'm constantly amazed and grateful for the connections. And there's a lot of evidence around, and I'm sure you've all heard it. We write down 5 things we're grateful for in a week. And there's a very famous researcher, Dr. Emmons, who did a lot of research on that. But I think what we found even more powerful than thinking about what you're grateful for is to really identify the why, what you're grateful for. So for instance, I'm so grateful the sun is out today. But why I'm grateful is that I love to see my cat sitting in the sunshine. I like to feel the warmth on my face. It allows me to connect with my neighbors after work and not be in the rain. And just reminding myself to be grateful for those moments. And again, around connection.
Every member of the cancer care team is a leader. How do we lead with gratitude? What does that everyday gratitude look like in cancer care?
I think, as a leader, there's things we can do with our patients and with each other. I think before I enter any room, my mindfulness practice is to pause. So again, kind of that stop mentality, feel my feet on the ground, take a deep breath, and think about something that I'm grateful for about that patient. And maybe I do that if I don't know them yet, I'll do it on the way out. Just really acknowledging what I'm grateful for in that moment, or the team that's taking care of them. I think it hit me most personally. Recently, I've been helping in the COVID units and having to get a PAPR on and go into rooms with aerosolizing COVID, and just kind of being aware of my own fear in those moments and being overwhelmed with gratitude for the nurses and staff that went in there before we had vaccines and not really knowing if PPE worked, and just have felt overwhelming gratitude for them. And I find myself grabbing them in the hall, not touching them, of course, and just saying, thank you so much for still being here and still doing this work. I think day to day, what we can do is I've made a practice of really trying to remind myself every encounter, every connection that I have, why I'm grateful for that person, and sending them a little note. And it's kind of been a way to keep my mood up. I think my mood is improved because I'm always looking for ways to thank the people around me for actions that they do or ways that they are in the world.
More often than not, we hear from our colleagues that helping patients is the reason they got into cancer care and the reason why they stay. We have to look for those moments. I hear that you have a personal story with the patient.
Yeah. I volunteer outside of oncology on Monday nights. I work with an organization called Portland Street Medicine, and we provide medical care and mental health care to the houseless. And this Monday, I was out and was grateful it wasn't raining and kind of knocked on a tent, and a gentleman popped his head out and, introduced ourselves and asked if we could offer him any support. And as he was talking, I noticed he had a giant tumor kind of protruding from his jaw. And I just simply said, "Is there anything you'd like to talk to the doctor here about tonight?" And he shared the story of having this cancer and really then shared the story of maybe how the healthcare world has let him down, unable to get insulin that didn't need to be refrigerated without a pre-authorization and didn't really have anyone to advocate for him, scared about losing his teeth and was going to wait to get medical care until he turned 65, which is in December. So he's waited 2 years with this tumor as it's been growing and obviously impacting his speech and swallow. And I think in that moment, I felt like anger of the healthcare system and how we kind of failed this person who was very vulnerable, but was also so appreciative that I had the time to sit and hear his story and connect with him in a way that I think I don't get to do necessarily as much as I'd like to day to day in oncology because of the hustle and bustle. And just so grateful for that opportunity to sit with him, hear his story, and start to build a bridge of a relationship and know that he welcomed us to come back next Monday, and hopeful with the building of that connection and relationship that we'll be able to get him the support he needs to be successful and to have healthcare the way he wants. And I think I'm just so grateful for the opportunity to be able to pause and have that opportunity to connect. And it's so important. It reminds me of the poem by the late Mary Oliver. There's an excerpt of one of her poems, Instructions for Living a Life. Pay attention, be astonished, and tell about it.
The Cancer Buzz team is incredibly grateful for our listeners. We know as a busy cancer professional, you have limited time, and we want to thank you for supporting Cancer Buzz. Please drop us a note and tell us what you think of the show, and go ahead and leave us a rating and a review. Next week on Cancer Buzz, a look into advocacy for equitable access to genetic counseling. Until then, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.